Hi, it's Dr. Renee, and here we are again for another after show with Breathe TV. Today, I'm joined with my, I'm joined by Katherine Jackson, and so I'm really excited. You guys just watched her episode, so now let's find out what's going on with Katherine now because that was shot a while ago. So let's find out what's going on. So, Katherine, please give us a kind of update from where you left off.
Hi, thank you so much for having me, Dr. Renee. Yeah, that was about a year ago, and then the year went by so fast. Um, and there has been a lot of progress with my treatment. I have actually am now on the seventh treatment. So a while back, I cannot remember the number of treatment I've been because I've been on several chemo drugs during that past year up till now. So I am on the seventh chemo treatment, which is called TrueCap, and it's a newer treatment. I believe it was a clinical trial, and then it actually became FDA approved it back in like December of last year.
Were you part
So
of the clinical trial?
I was not a part of the
Okay,
clinical trial.
because
Yeah,
we try to, and, a
yeah,
Black doctor, they really try to promote clinical trials. So that's why I was saying that.
yes,
But no, but also though, before you go any further, this shows you firsthand how important clinical trials are, everyone, because a lot of people, especially our people,
yes.
do not like to participate in clinical trials, but they are so important. And this is one of the reasons why they are so important because this is the
Yes.
treatment now that she's on. And just for those that didn't see the episode, what type of cancer are you fighting?
I am fighting stage 4 metastatic breast cancer, and I
Okay.
do have ERPR positive, HER2 negative. And it has spread it to it came back because this is my third time actually fighting breast cancer. It came back, and as what I unveiled in, the brief TV episode. What happened was they tested the tumor because it spread it to my liver. So I had two major tumors in my liver, and then one on my right hip bone, and of course on my right side where it first started, and then the left side underneath my arm area right there. And so I've been on several treatments even since last year. I believe I still had hair on that Breathe episode, and then I lost all my hair, and now it's actually growing back. As you see, it got a little bit
Yeah.
gray hair though, but
Hey, it looks great.
you know. So I am on the chemo drug TrueCap, which is my seventh treatment, seventh drug, I should say. It's not my seventh treatment. I've been on several treatments. I don't even know what number I'm at. But so this is the seventh drug, TrueCap. It's pills instead of infusions because I do have a port right here. I don't know if you can see it,
We
but
can't see it. Your name's in the
yeah.
way.
But I have a port. Um, and I stopped taking infusions back in February of this year, and then we started TrueCap at like I would say around the end of February. And TrueCap is what I've been on so far. So usually every time I started treatment, I would be on that treatment for a couple of months, and then I would get my scans. I get my scans May the 28th this month to see, and crossing my fingers if this medication is working. I hope it is. And the thing is, what is a good sign is when they get blood work, they have a do the comprehensive one where they look at your liver enzymes and all your blood count and everything else. So the good news is that TrueCap, since I've been taking TrueCap, which consists of 2 pills in the morning and 2 pills in the evening time, and so far, my liver enzymes are going down, which I'm so excited. Like, so I feel like that is definitely a good sign that the medication is working because on the previous treatment that I was on, which now I feel like I have chemo brain because now I can't remember which one it was.
It's okay.
It was an infusion though, but I had I think it was Abraxane. Okay, I think that's what it was. Abraxane I had and it was not working, so my liver enzymes was still up there through the roof. So my doctor was like, "Hey, let's try TrueCap. It's a newer drug. It came out in December, and let's try it." So I was like, "Look, I am open, okay." So now I just feel better, and I really, really hope and pray that this medication is working because also last month, actually, I went to MD Anderson to get another opinion because, And you just got to have another opinion,
Yeah.
just, just to see, it's not that I don't trust my doctors, my current doctors at where I go right now, but it's just I wanted to go to, which is the number one hospital in the nation.
Yep.
I wanted to see what they say as well as far as my treatment, because like I said, I've been on 7 lines of different chemo drugs. So it's like now it's number seven,
Hmm.
and I've been on number seven. It's been back to back to back to back. So I went down there and they actually confirmed that TrueCap is a great drug, and there is other options. It's just like you said, clinical trials that are there, but it would probably require me to be monitored more closely in the event that this medication does not work. So I'm hopeful that this medication works, because I do like the fact that I don't have to keep going in like I was with getting all those IV infusions.
Right.
And I feel like I can kind of better manage everything, my schedule, and
Hmm.
I work from home, but even working from home, I still have so many things that I got to do,
Right. No, no.
So,
Perfect. I understand.
and that's why I was like, I'm so, I'm really just hopeful that on May the 28th, it shows all good signs. And it's good to know that in the event that if this medication doesn't work, then I still have other options. Because as you know, when you get to stage 4 metastatic breast cancer, especially in different places, you kind of like, as you go more and more down the lines of the treatment, it gets kind of more difficult to figure out if this is actually going to work, or it's just so like harsh on your body, where
Yeah.
it's just like you really almost give up. But I've never been that person, because I do have a daughter. She's 20. Although she's 20,
Oh,
she's
you do
still
not look
like,
like you have a 20-year-old though. God
yeah.
bless.
So you know what I'm saying? So it's like trying to be there for her and give her awareness of checking your body and everything. And it's just, she sees me going through everything, and I'm just not a person that gives up, because I feel like the more positive vibes you put out there, and positive comes back, and you have to
I
have a
agree.
positive mindset with this.
You
So
must.
you
Must.
definitely must. So that's kind of where I'm at right
Yeah.
now, and still advocating. I'm always about advocating, especially when it comes to the clinical trials. Clinical trials is one of those things that, like you said, our people are like, no, I'm not going to have them experimenting on me and all that stuff.
Exactly what
But
they say. Exactly.
yes, but that's part of the reason why I tell people at some time, majority of the medications out there were a clinical trial.
They
So
all had to
like,
be. They had
yeah,
to figure out what worked,
exactly,
how it worked, who it worked on. And
exactly,
I keep trying to explain to people for many years, they did not worry about testing them on anyone that looked like us. So therefore,
exactly.
we might as well be a guinea pig because they've never given the drug to anybody black.
Exactly. So that's
So
what I
why
explain.
not let's be a part of the clinical trials so that we can help the future, and these drugs can actually be tested on people that are have our makeup, because we are not all the
Exactly.
same. You need to test on people that are, you need to test on women, you need to test on men, you need to test on young people, old people. But if you don't have any diversity in your pool, then I don't know how you can say, well, this drug is great. Well, you didn't test it on everyone, so I'm not sure that it is great. So clinical
Exactly.
trials are so important, particularly to us, because we want to make sure that every medication works on us as well.
Exactly. And I agree with you, because I feel like I've always been that person that's like, what's the discretion part? Like, only 25% of the people get breakout and highs, blah, blah, blah. I'm always that
You said you're
person.
that one.
I'm always that person. I'm like, it never fails. And it's like, anytime I would say modern medicine, like, I'm always that person. I've had broken out in hives. I've even had, throughout my whole journey since I've been dealing with this since 2018, I have had highs. I've had everything you think of. I've even had shingles during the process of the whole thing. And people always assume, like, even the commercials, it's like, oh, you gotta be this age to get shingles. I'm
Yeah, I was
like,
gonna say shingles is
wrong.
usually the senior citizens
I'm like, wrong.
virus.
Okay. Like, so nobody can say that. I'm like, I've had it all, the pain, the highs, the shingles. I've had COVID. I mean, all of it. Okay. And so that's why I was like, if it's not for like these clinical trials to test out different things that, like, of course, us participating more into it, we're going to have that person like me that has 20%. I'm in the 20% or whatever, and I'm gonna get getting the highs and stuff because they didn't show that the demographic didn't show that, hey, these people of this descent, they got this or that. It's only one makeup, and
Right.
that's the problem I still have with all drugs, not just breast cancer drugs,
No, no, it's
or
all drugs. Yeah.
it's all drugs. Like, that's the problem I have because I've always had all of those side effects, and it's kind of hard because you start to be like, okay, well, if they're all looking at this same demographic, all these other people are lacking in the help that they need because, of course, they, are a lack of our participation in those clinical trials. And I feel like, and this is just me saying this, I feel like there's not enough push for that demographic either. You know, like it's
But they're working on it. They're working
yeah,
on it.
yeah.
And I
That's
will say,
like yeah,
blackdoctor.org actually has a tab on their website,
yeah,
blackdoctor.org. It's for clinical trials. So everyone, please go visit because you
yeah.
just never know. And you do not have to be sick to participate in clinical trials. You can be healthy
Yes.
as a horse. You could be very beneficial. I don't know if you've seen, there's ads now, and we did a show about lipoprotein A, and it's I've seen ads in my Instagram feed even, and they're looking for Black people to participate so we can figure out why it is that we end up with this lipoprotein A and have all these different heart problems because of it
Yeah.
and stuff. So, you know, they are trying. They are really, look at, like I said, this is in my Instagram feed. So they are
Yeah.
really, they're going out there where we are to get us to do the things that we need to do. So,
Yeah.
I will say they are doing better.
Yeah.
And there's a lot of reasons that they have to do better, but they are working on it and they're trying to do better. And so, put it this way, from 2024 back to 2018, like you said, there is
Yeah.
a vast movement to make certain that there is diversity in clinical trials. Thank God. So,
Yes.
yeah, so it's very important. And then you said advocacy, and that made me immediately think I just overheard, and I was like, that's wrong information. They said that, oh, they've moved up the breast cancer screenings to 40. They used to be 50. And I was like, that's not right. They were always
Right.
40. I
Exactly.
don't know who got that information and let them say that. I don't remember where I read it, where I heard it. But I was like, that's not right. It was always 40. What we need to
Right.
do is move it to 30,
Yeah.
particularly in Black women, because Black women
Exactly.
are the ones that are getting it the youngest and dying the
Exactly.
fastest. So, if nobody else, insurance companies of Black women need to make certain that if you have
Exactly.
Black women as your insurers, you need to make certain that they're getting their mammograms covered at 30 years
Exactly.
old. Because, and so I will say, my doctor at 36 did a baseline. And so I had my first mammogram at 36. And my insurance covered it. I called and made sure, and they covered it. I'm
Yeah.
not going to name them because I'm mad at them right now. They're not covering something else, but they did cover it, and so that is very important that you do self breast exams. But there are things that those things don't detect. And
Yes.
actually, when I turned 40 and went back for my regular, I'm 40 now mammogram, they found something, but
Right.
it was so small and it was like on the back wall. I would have never felt it in self breast exams,
Right.
but it was what they saw in the mammogram. And then I had to have another one, and then I ended up with a biopsy. It was fine and whatever, but it was a long ordeal.
Wow.
So, but I knew for a fact that, especially after I saw the imaging, I knew that I would have never felt that.
Yeah. And see, that's another thing, like you said, that push for advocating. Like, I do say that my doctors did push because I got diagnosed at 32.
See, that's what I'm
And,
saying.
and it just does not make, and that's my whole biggest push too, is that the legislation and it has to be a movement where it gets lower, like the age has to go, just like you said. And African American women, 30. I've met people even in their 20s
No,
that
no,
had breast cancer.
I know
You
plenty
know?
of doctors that are breast surgeons. Yeah, I
Yeah.
know plenty that have told me that they've had patients in their 20s. And that, I mean, I'm trying. Look, we can't ask for much. So
Right.
that's why I
Right.
said, could you lower it 10 years? I
Exactly.
know it's going to be far fetched for them to lower 15, but could you
Yeah.
get it down 10, and maybe in 3 years we can ask them to go
Yeah.
another 10? You know what I mean? Like, because
Yeah.
they did lower, they lowered the colon cancer screening for everyone, even though it was us that was mainly the ones
Right.
dying.
That's what I'm
But they
saying. Yeah.
they did
Yeah.
lower it for everyone because it was 50 and now it is 45, and
Which
your
I
insurance will
still
cover it
feel.
at 45. But I will tell you that, and this is totally off subject kind of, but Chadwick Boseman was actually less than 45.
That's what I was just about to say. You took
Yeah,
the words right out of my mouth. I
yeah.
was like,
So
it's hard for me to. I just feel like, why is there so much limitations to get the things that we need?
I know, and
I
the
don't
pushback
get
is
it.
awful, and the
Yeah.
costs are ridiculous. I had to get I had to get a scan for something, and I didn't know that my insurance wasn't covering it, and they told me, like, literally the week of the exam, they were like, your insurance isn't covering this. Do you want us to try and find someplace else? And when they showed me the bill, it was like $3,000 to $5,000.
Ugh,
And I was like, yes, you must find someplace else.
right.
And they did, and it got covered. But this is why I'm saying that it's so important that if the doctor feels that this person needs to go on and have this scan, then you need to say, oh, and then cover it. That's all.
Exactly.
Just easy peasy.
That's it.
And
That's
the
it.
thing with breast cancer, unfortunately, similar to colon, people are not necessarily sick. And so,
Yeah.
because there's no signs and symptoms per se for most people, although colon cancer, some people do have blood in their stool, but breast cancer, as a matter of fact, there's a story. It's in an article. Chance the Rapper's aunt died of breast cancer. She said, "Well, I was feeling fine."
Yeah.
Okay, well, that doesn't mean you don't have breast cancer. Now, some people do
Exactly.
have the dimpling, the orange peel looking, of their breasts. And okay, so if your breast changes on the outside, then you definitely go say something and get something done. But there's a lot of times that you don't see anything on the
You don't
outside, you
see
don't
nothing.
feel any different,
Exactly.
and you have no reason to think that there's anything going on. And that's why we need to allow for the screenings to be at a younger age, because then when you go, your doctor will be like, oh, you're turning 30 this year? Make sure you pick up your prescription for your mammogram on your way out. And these are the places where you can have it done. That's why it needs to
I
be done
agree.
that way, because you wouldn't know. And yes, like I
Right.
said, you should teach, I'm sure you did, you should teach your daughters as soon as they have breasts.
Yes.
And actually, men get breast cancer too. Let's be serious and honest about
Yeah.
it. You need to teach them how to do self breast exams. And they need to know so that if they do feel something, they can quickly alert you. And plus, if you learn how to do a self breast exam when you get breasts at 13, then you will know your breast so well that if something is out of the ordinary at 35, trust and
Yes.
believe, you know every inch of your body, and you will know, I mean, your breast, you'll know, and you'll
Yeah.
know that there's something different. And so that, to me, yes, it's important for self breast exams, but we all know that there's a many of people that are not here with us anymore who did self breast exams very regularly, but it was not found that way. And then, of
Exactly.
course, there's also, it may not necessarily be found with a mammogram either. There are some people who do need to have an MRI and
Yep.
or an ultrasound. There's so many different screenings that need
Yep.
to happen because not all breasts are made the same.
Yes. Exactly. Cause I'm telling you, I was the one, like, I was a C cup. So I noticed it right away that I had that hard lump right there. But some people, like my daughter's bigger than what I was. So sometimes you can't feel, and
And
just like you said,
I have cystic breast. So it,
yeah,
but I've been doing it a while, and I've noticed when notice when something is out of place. And I was like, wait a minute, what's
yeah,
that? But that you just have to, like I said, if you do it enough, then you'll know, and you will know, you'll be good, and you'll be able to alarm the
yeah,
doctors. There's another story of a young lady who was 30 something and she felt something, told the doctor, and the doctor said she was too young.
And that happens very often.
And by
Very
the
often.
time she was diagnosed, it was stage 3.
Yes. And I am friends with so many breasties just across the US that I've heard the same story time and time again. And I'm just so tired of seeing that, you know?
Yeah,
And unfortunately, another thing, I was on my care. Now, you can't control, I guess, how cancer can come back and everything else. All you can do is try to hope for the best,
right.
pray that everything is going to be all right. But it's like this stuff can happen so fast in a
Mm-hmm.
blink of the eye, and thinking about it, like, especially when you're in, your 30s and 40s and even like 50s, you're like still working, you still got all these other things
Yep.
going on. So you might not have that time that you can take off. You might not have the time to even look at and get in the physical or anything else, or you just like so
No,
go,
but
go,
you
go,
have to make
but you
your health
have
a
to.
priority.
Yes, you
I
have to
am
make,
so sorry.
yeah,
Health is wealth. And if you do not have your health,
exactly.
you have nothing else. And I always say,
Yes.
they will find someone to replace you when you die faster than you would even believe.
That's what I say
So
so
you
now.
don't have to worry about bills or anything if you're dead.
Yeah.
But that's why you need to make sure you
And
go
you
to the
can't take
doctor.
none of that stuff with you. So,
Exactly. Go to the
you know,
doctor, get your physical every year. Women, we have to have our annual exams every year. You need
every
to make certain you go, make sure you know your numbers. You know, diabetes
hmm
is plaguing us, hypertension is plaguing us. You need to make sure you know
Yeah.
these numbers. It's so important. So
Yeah.
I literally just I did a live yesterday and I talked about how just we not even halfway through the year just yet. And I know about more than a handful of people less than 50 that have died.
I'm telling you, I've known
And I
even,
don't think any of them necessarily had cancer either. These
yeah,
are people who dropped dead of a heart attack or just didn't wake
everything.
up
Yeah.
because of
You
a heart
just don't
attack.
know.
So we need to take care of ourselves. It is so important. And I'm telling you, you have nothing to worry about when you're dead. So please
Exactly.
take care of yourself. And then, if not for yourself, I'm
Yeah.
sure there's somebody that loves you. If it ain't your
Exactly.
mama, if you don't have a husband or wife, if you don't have children, you don't have a daddy, you got somebody that is
Exactly.
concerned about you being here. Do it for them.
And exactly. And I tell a lot of people also too, you work all this time, spend all this money, and especially if you work at an organization a company that's actually paying for your insurance, your healthcare insurance. Why not
Why
use it?
not use it?
I don't understand it. You just gonna have this money keep coming out your check and not use it? Like, that doesn't make no sense, because I know I use mine all the time,
Exactly. Well, I pay for my own, but
you know?
I will say also that there's a lot of people that will. I'm gonna go to that doctor, but then I'm not gonna worry about this. No, 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 no. People don't understand. Your whole body, your whole body, they call it your temple for a reason. You need to take care of all of it from the top of your head down to your feet.
Exactly.
So you don't know how important teeth are until you get an infection. There was a football player, he died. NFL, he
Yes.
died.
Yes.
Tooth infection that he just ignored. Of course,
Exactly.
tooth infections, people don't realize, can lead to heart problems and infection.
Yeah.
He died. Take
Yes.
care of your teeth. You need to go to the dentist every 6 months. Go
And
to the
I'm telling
dentist.
you, annual, get everything,
That's what I'm saying.
like,
You got to take care of your entire body.
yes,
I had to have a bunionectomy. You don't know how important it is to be able to walk on your big toe till you can't.
yes. I
And those with
already
diabetes
know.
who have lost their big toes, they can tell you how important it is to have a big toe too.
Exactly. It's a
But
place
that's what I'm
for
saying. You have to
everything.
literally start at the top and the whole body. If you
Yes,
have to take an entire day off work, a week, whatever, you need to make certain that all parts of you are good.
exactly. Because I can tell you so many people like that be like, oh, I'm gonna go on this, I'm going to Jamaica. And
Right.
I'm like, you could go to Jamaica. You could spend one day just making sure that you okay. Okay, just one day. It only takes
And
one
the
day.
worst thing you want to do is get sick overseas. So
Oh yeah,
therefore,
exactly.
you don't want to get sick
Exactly.
on vacation.
And then a while back, even before I got cancer, a young lady that used to train a lot. I used to be in the gym a lot. And this one young lady, she had to be like 30. You might have, I don't know if you've seen it on the news. It was like she went to Dubai and she ended up pass fainting in Dubai, and then she ended up dying. And she died of an aneurysm, and they had to ship her body back from Dubai all the way to the US. And it was like crazy trying to do that
Of
because you're
course.
in a foreign country,
Yep.
you're dying. They're trying to figure out what they're trying to do a autopsy over there
Right.
and all types of stuff. And I'm like, and everybody was just like, oh my God, I thought she was fairly healthy. And, going on that trip,
Well, that's the thing. You
you
don't,
just
if you
don't.
don't go to the doctor, you don't
Yeah,
know what's going on.
exactly.
Everything could appear to be really great,
Yeah. And
but
you
you
don't
don't know
know.
what's doing.
And that scared the heck out of me. So like that was a long time. I want to say that was probably like maybe 2015-ish range. So that's what made me start really thinking about. I'm like, no, I'm taking off. I'm taking off to go because that really scared the heck out of me back then. And
Hmm.
so ever since then, every time I would make sure, like, okay, this is my time for the annual exam. Of course, since having the daughter, you got to get, your pap smear and all that
Right.
stuff. I'm
Yep.
like, no, okay. I want to make sure annually. I don't even care if you saying it's not required, but
Right.
I want to do it annually.
Because they're
Like,
very confused on that too.
you're right. Right. They'd be like, oh, you don't have to do it. You could do the
Yeah.
three. I'm like, what? No. I'm like, I'm sorry. No, no, no. And that's why I said, like, no. And that's because when I first got diagnosed, like I tell people, it was not my regular primary care doctor. It was my OB-GYN doctor that actually was the one that I know that was like checking the breast regularly that I went to because
Hmm.
I found that lump. And I had just went to her. And so she was like, wait, you just, and that's how fast, and I tell people that's how fast cancer
Oh,
can
yes.
spread.
Hmm.
It can come so fast on you.
I know
And I was
people who
like,
had a mammogram one month
yeah,
and the next month they were diagnosed. Hmm.
yeah. And that's what I said. Like, it can spread so fast. Like, this is a matter of like maybe almost like 2 months. It was that quick,
Right.
that quick. And I was like in shock because she was like, yeah, you just came to me. I was like, yes, I know. And I was like, nah, I just felt this big old like hard thing. And I'm thinking like, and then and that she was like, the crazy thing is that at the time she was the new resident, right? So the main doctor that I had, which I don't like, no name, no names, but she was not us, I should say,
Uh-huh.
and the resident was us.
Okay.
So the other doctor, the main doctor that I had, was kind of pushing it off to say like, "Oh, they're like the resident," because it's a bigger hospital. You know how it is, bigger hospital. They'd be like, "Oh, you can see the resident, or you can see my PA, whatever
Right.
it is, right?" And so then she was the one was like, yeah, this don't feel right right here. I know this don't feel right. And she was like, you're so young, and either way, we gonna get it checked out, even if it might come back benign, but it didn't. So that's why I was like, the crazy thing is you never know if you don't like if the person is not for you and everything else, you just never know. You never know
Right.
at all. And because I don't know nothing about breast cancer at that time. I remember like a lot of people, but I was, I didn't have any relatives that like were directly, how you got an aunt of an aunt of an
Right.
aunt,
Right. Right.
but like I wasn't directly impacted
So it
from
wasn't, so
breast
this
cancer.
wasn't even something that was in your family.
It wasn't. It wasn't at all. And so, like, the only person that really had a type of cancer was my half sister. We had the same dad, not the same mom, but she died in 96 when she was 6 of leukemia. And
Okay.
that's the only kind of like a little bit like a form of it, but it wasn't directly breast cancer at all.
Gotcha.
So I would see the ads, and everything else, and I'll be like, oh, okay, but as you just, that, you like, well, maybe I ain't gonna get it, whatever, you're going about your day. But I remember if you go, of course, if you go to OB-GYN, they checking all that anyway with your
Yep.
pap smear and everything else. Or like I said, they should be doing that. But
Hmm.
um that was the only person I know to call because a couple months ago, like I didn't feel that at all, just that quick, that popped up that quick. And then they told me, yeah, you're diagnosed with stage 2B to 3, um, ERPR positive, HER2 negative. And I didn't even know that. I was looking up everything, you
Right.
know,
Of course.
and I didn't know what those meant. And then she broke it down and explained everything to me. So it's just fast, like just like you said, we have to keep advocating and going to the doctor, even if they say you're not, well, you don't need to have it. No, I want to have it,
Mhm.
like, and calling though. And what I do is, I don't see, I'm one of those people, I don't take no for an answer. I'm calling that insurance companies, be like, what is covered and what is not. They telling me something totally different. I just want to make sure. So if I go to the department that is running it through the insurance, I know what is covered and what is not,
Mhm.
because I'm gonna be like, no, because plenty of times me and my doctors were going back and forth saying what is not covered and what is. I'm like, I'm paying all this money and it's saying this X, Y, and Z is covered. It never said that this wasn't covered underneath there. So either your what you are saying in this plan is not covered and what you writing down right here is a lie, or and then after that, guess what? They approved it because I'm proving it wrong. I'm like, what are you writing stuff and saying this is covered in the plan, and I'm over here. You talking about it's not covered in the plan, or is it that you just don't want to cover it? Which one is
Yeah.
it? like,
But you're right though. I'm one of those people too that will call, and unfortunately, there's a lot of people that are not those kind of people.
yeah, yeah,
And so then they take that, and it's not good that they take that because that could cost them their lives. I know somebody that she was one of those people that calls, and
yeah,
her doctor wanted her to have this. And I don't know that if she'd be here today if they did it when they should have done it. She wanted an
exactly.
ultrasound, a breast ultrasound, and she did end up dying. But she was one of those people that she was even posting it online, like, what is wrong with this insurance company? My
Yeah,
doctor wants to
yeah,
order this. This is what I need for my, I think they were trying to stage her or something. But yeah. So
yeah. And the fact that people don't even know, like, when I know a lot about somebody out of like learning and
like,
basically
yeah,
like talking to my doctors and doing that and think
ask
about
questions.
and questions, and the fact that two of my really 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 good friends are nurse practitioners, doctor nurse practitioners, so I'm always like at backup of a backup. But there are some people like that don't have that, and
Hmm.
I feel like I'm so grateful to have all of these people around me to say like, oh no, have you talked about that? Have you seen this clinical trial? Does this available? So I'm already like, look, thank you for keeping me on board because I'm always looking at the clinical trials. I'm always going, but I've just like you said, I've always been that person
When you get there
that
the
has
next
done that
time, I'm
research.
gonna have to take it. This is
I I've always been that person that does that research, and because even when this medication had came out, I didn't. This was such a new medication. I didn't have a nothing on it. But when people don't understand, even when you get blood work done, it depends on how the doctor is writing that up too, because they can only be, and you can speak on this too even more. It's like different types of panels that they want to see, because
right,
I didn't even know it was like the different ones with the liver enzymes and they looking at the sugar in count. I don't know, how they run blood, sometimes. I'm just thinking like, okay, shoot my arm and that's it. Like, or, I'm like, hey, whatever y'all look at, whatever y'all
right,
look at. Because I found a couple of times that although I wanted to get in clinical trials, at this point in my, diagnosis, I wasn't eligible because of that liver count and that liver
got you.
enzyme
Okay,
panel.
okay,
So that was one of my issues that I have had. And even when I went down to Texas and asked them about that, because I'll be like, okay, I just want to make sure they tell me the right thing and
right,
what you saying. And they said the same thing. They was like, yeah, you do have to be at a certain point in your liver enzymes just for,
right,
for them to run different things. But that's not all clinical trials though. So it doesn't have to mean that one, but there's other options, So
yeah,
I was just like, and that's what I've always been an advocate for. Like, I am a firecracker, especially when it comes to them insurance companies, because I'm like, look, you're not just gonna tell me
yeah. It
anything,
can take a lot of time, but it's absolutely necessary.
Yes. Cause
Yeah.
I'm like, look, no, whatever way. And then I'm calling whoever the manufacturer, like, is there a way for me to get this
Yep.
drug somehow? Or
Exactly. That's what
tell
you do.
me how can I get this? Okay, without paying $100,000. Okay, so I'm trying to figure out. And sometimes most of the time, people don't do that research as well, because some of the time that they'll cover like a couple of months until you even get approved or find a way to get approved for your insurance, because sometimes you'll have, the those assistance programs to help you
Yes.
get the
Yes.
drug. And then, if your insurance approves it eventually, because I even had some times where I was delayed from the actual drug getting approved, but then it would be like sometimes those injections, like the injections I have to get Zoladex and I have to get different like Exgiva and Fossildex.
Right.
Sometimes they'll pay for it, and then my doctor would have to like rewrite it up or whatever. They got that, like people got 1,000 pages, just like yourself. You got
Yep.
1,000 pages. It's like I can't keep track of sometimes all these people to go and have my people scan in. Yeah, and then you going back and forth for the insurance companies. It's a
It's
lot.
a lot, but it's good that you're one of those patients that keeps track everything for them.
Yes.
Is there anything last minute that you would like to share with our audience about breast cancer or metastatic breast cancer?
Yes. So I would share that you just have to have a really good mindset. And then sometimes, so I'm really big on changing like your mindset, Yeah, it might be a grim kind of like diagnosis, but it doesn't have to be grim. I always say like I have cancer that does not have me. And that's who I've always been. And I know that sometimes that you could, I mean, you never know how you feel each day. It's a definitely hard diagnosis to go through, but you don't have it doesn't have to be that way. And you just want to continue to advocate for yourself, continue to do your research about everything, even the drugs that you're currently on. Maybe that might not be the best drug, or even looking at the hospitals that do provide more access to different drugs, or even the clinical trials. Just start like researching and doing those type of things, because like you said, you only get one life. And while you're here, you want to live it up to the best fullest, to your best. I
Yes.
say YOLO, okay?
Yep.
You only got one life. So that's one thing I would say, and that's what I give to the people pretty much. Because I've always been that person though.
Well,
So
thank you so much, Catherine. And we are
yes,
sending wonderful prayers that you get great
thank
news with your
you.
scans. I know you will. And thank you so much,
Yeah.
everyone. And we'll see you next
Thank
time.
you for having me.